You're outside enjoying the beautiful day, the nice weather, and your brother comes out of nowhere and breaks his arm. Hello, my name is Jonathan Prada. Today I'll be teaching you what to do with an injured arm, how to splint it, and what to do afterwards. The first thing you want to do is you want to assess the area. You want to make sure that the scene is not dangerous, because going into a dangerous scene would not serve you or the patient any good, and will only be putting yourself in harm's way. Once you assess that the scene is secure and safe, you can now assess the arm. You want to see if it's dislocated, a sprain, or whether it's an open-closed fracture. If it's an open fracture, it's when the bone is protruding and breaking the skin, while a closed fracture is while the bone is broken but does not break the skin. If you don't know what it is and you're in doubt, splint it. No matter what, just splint it. Before you actually start the splinting process, there are two things you want to do. You want to see if he has a distal pulse and he has good capillary refill. A distal pulse is a pulse away from the heart and away from the injury. For example, if he breaks his arm, his distal pulse away from the heart, away from the injury, will be found on the radial artery. If he has a pulse, then he's good. The next thing you want to check if he has capillary refill. You check capillary refill by pushing down on the nail bed where it will change colors and by letting go. If the color comes back in under 2 seconds, then you're good. Now once you have done these things, you want to actually start the splinting process. Now if it's an open fracture and he's bleeding a lot, you'll want to pad it to stop the bleeding with sterile dressing. If you don't have any, then you'll have to use the items around you.
Get it? No, stop. Turn around.
Lay down. If you don't have, now you'll want to pat it with a stick or use items around to stabilize the injury. For example, the stick. Next, you want to use the items around you to stabilize the stick. For example, someone's t-shirt. You, give me your shirt. You'll want to take the shirt, wrap it around, and you want to tie it in two places, above the break or injury and below the break or injury. After you successfully tight the splint, you don't want it to be tight, you want it to be snug. A few things to keep in mind is if there's any swelling, you will like to apply some ice. But if you don't have any ice, then you don't have to worry about it. Hey, is there any ice? There is, but you don't want to apply it directly to the skin. So you want to apply it, tuck it in the shirt, to the skin. You don't ever want to try to push the bones back where they are. You only want to splint as it is. After that, now that you have successfully splinted the arm, there are a few things you want to do. The first thing you want to do is to recheck capillary refill by pushing down on the nail bed, and if the color comes back in under 2 seconds, then you're good. But if it does not, then that means that your splint is too tight and you'll have to readjust the splint. Now the second thing you must do is you must take him to the hospital. The splint is for a temporary purpose. It is to minimize pain, immobilize the injury, to stop excessive bleeding, and even to stop him from moving it and possibly getting it worse. Because of your splint, his injury would not get any worse. You want to take him to the hospital as soon as possible. My name is Jonathan Prada. Today I spoke to you about what to do with an injured arm, how to splint it, and then what to do after the splint. You may think that you may not need to ever use this skill again, that someone else would know how to do it. But that's not the mindset you want. You want to think, if not me, then who?